bless you. Welcome again to the Spice of Life variety show. We're so honored to be in your presence and to your homes and wherever you may be viewing us, and know that we are just really looking forward to having an informative time today on today's show. I hope that all is well in your life, and if not, then certainly we have a solution to make it all well in your life, and we will share that with you in a few minutes. I'm sitting next to my lovely co-host, Pamela Webb, and certainly Pamela has some information to share with you. So I want you, before Pamela speaks, I want you to grab your pen, your pencil, your paper, anything that you can contact us with, take down our contact information at the conclusion of the show, our phone number. We want to hear from you, and certainly you will want to also contact our guests, and so you'll want to contact our information at the very end of the show. And so, Pamela, what is the show about today?
Well, Dr. Lewis, as you can verify, several months ago, I was having an awful problem with my back.
Right.
And I had made the comment a few weeks ago about, it seems like I remember people saying they always have to take a Tylenol in the morning. Mm-hmm. Well, I've been taking Motrins because of my back
pain.
So today is, who needs a chiropractor?
Very befitting?
Yes, very. So I'm just really eager to hear what we're going to hear today.
Okay.
And our guest is Dr. Frank Direct. Direct. I'm going to get it right.
Dr. Frank.
Garrett.
Pronounce your last name.
Darrett.
Okay, all right.
We got it now. Dr. Frank, everything is fine now.
Everything is fine. And of course, before we go on, and certainly welcome Dr. Frank. You will hear me affectionately call him Dr. Frank. We give honor to our pastor and Bishop Charles E. Blake, Mrs. Blake, and the entire West Angeles family. Thank you for allowing us to do this. Yes. Dr. Frank, welcome.
Yes.
Welcome to the show.
Thank you, Dr. Lewis. Thank you.
Now, let me ask you this. What are you? What is a chiropractor? What do you do?
I am a doctor of chiropractic, and a chiropractor is a natural health care doctor. And a chiropractor primarily uses his or her ability to manipulate the spine, physical therapy, nutrition, and rehabilitative exercise to correct the problems of the patients that will come into a chiropractor's office. Primarily, it's a natural health care doctor.
A natural health care doctor.
Correct.
So who would, in fact, need your services? Who will be your market?
Basically, any and everyone. Chiropractors see patients that may be vulnerable to injuries as a result of not having their ergonomic setup correct at the workplace. Say, for instance, they're working in a location where the computer is not properly situated. As a result of that, they could have problems in the upper trapezius muscle area, neck area. Sports injuries, athletes come to chiropractors. Laborers that are doing a lot of lifting. Basically, everyone can benefit from chiropractic care, primarily because everyone has a spine.
Everyone, that is the linking factor here. Everyone has a spine, like this here that you have beside it.
Yes.
Okay. You want to share anything about that particular spine right now?
Well, this is just a model
Okay.
of the vertebral column. You have 7 bones in the neck, which are referred to as the cervical spine.
Okay.
Then you have 12 bones in the mid-back, which are referred to as the thoracic spine. And you have 5 bones in the base of the spine, which are referred to as the lumbar spine. Then you have discs, which is a spongy material between the bones,
Okay.
which serve as a shock absorber.
Okay.
And then you have nerves. The yellow structures are nerves that branch from the spine that literally go to all parts of the body to control and coordinate the body. And most importantly, Dr. Lewis, between the vertebrae you have the spinal cord, which is a branch from the brain.
So when they have someone has a pinched nerve, what's happening there?
Okay, that's a good question. What happens when someone has a pinched nerve is that most oftentimes the vertebrae are referred to are the bones in the spine.
Okay.
And what can happen is that These bones are mobile. They
Okay.
can move.
Okay.
And oftentimes they can malposition. And if a bone is pretty much displaced, or the correct term is subluxated, what will happen is that it will put pressure on this yellow structure.
Okay.
Now, whatever part of the body that this yellow structure goes to,
Okay.
that part will not function
That will-
properly. And that's what a pinched nerve is. Missile lamina of the vertebrae, the correct term would be a subluxation. That's what a pinched
Dislocation.
nerve is referred to.
Wow.
Vertebral
Wow.
subluxation.
Okay.
So, Dr. Frank, if I'm feeling fine, why should I come to you?
You can still benefit from chiropractic care because oftentimes a problem that you may have, you may not have symptoms at that particular time, but a problem may be in the process of manifesting. So you don't always just want to use how you're feeling as a barometer as to your state of health, especially when it comes to the spine. You can have vertebral subluxations oftentimes and be unaware of it, and that's why it would benefit one to come to a chiropractor for an examination or a chiropractic screening, because a chiropractor is skilled in feeling the spine. It's called palpating the bones in the spine to make a determination as to whether you have any bones out of place which would result in pinched nerves. So to answer your question, Pamela, you could still benefit by going to a chiropractor even if you're feeling well, because oftentimes problems will manifest later. And if you're able to make that determination beforehand, it could be corrected easier.
Because let me just inject. I had the pleasure of visiting your office, and I was feeling fine. And of course, I just knew that he wouldn't have anything to do with
Yeah, what are you going to do?
he wouldn't have anything to do
Right.
for me. And it was amazing how you still were able to align my spine, and you did some things that, and I felt those things, and it felt really good once he did it. But I thought everything was
It's
just
fine.
well
Yeah, you just
because I
fine.
was feeling well. And so, like you said, we all can benefit. We can't use it how we feel
Correct.
to come,
Correct.
because some things can be out of order.
And we never think about being out of alignment.
And then also you can benefit from just by preventing certain problems.
Prevention.
It's a good preventative measure.
How young should someone be? How young are your patients, or how young?
Well, my patients range from all ages. I would say that a person could initially benefit from chiropractic care in their infancy. I've adjusted patients during a time of pregnancy, and after they've given birth, a couple of days later, I've adjusted the infant. Children and infants can be adjusted because chiropractors are trained specifically to adjust children. And oftentimes what can happen is that through the birth process, that can be traumatic to the spine, so alignment would be called for.
Is that the same thing as the adjustment?
Correct.
Okay.
It's just a particular technique that is provided for a child, which would be different than the technique that you would use for an adult.
Wow.
Now, is it true that chiropractors do not prescribe medication or do surgeries?
That's absolutely correct, Pamela, and that's one thing that I'm happy to say that we don't, because that's just not the way that we're trained, and that's not our approach. There is a time and place for medication. There's a time and place for surgery. But wouldn't it be better if you were able to avoid having to take medication? Wouldn't it be better if you were able to avoid surgery? And chiropractors provide the care that they extend without medication, without any surgery, and they do that, as I mentioned before, by aligning the spine. Oftentimes, problem can result because of the pressure on the spine. Whatever part of the body, actually the pressure would be on the nerve. Whatever part of the body that nerve would flow to, that part would not function properly, okay? That could be a muscle. Say, for instance, a muscle in the lower back is not receiving proper nerve supply. Going to a chiropractor would not prescribe medication. Hopefully they wouldn't need to have surgery. What a chiropractor would do would be to realign the spine. And in realigning the spine, that nerve can then flow freely to that particular part of the body, and then the body has an ability to heal itself. Chiropractic's based upon the philosophical thought that the body has ability to heal itself.
Now, you may have said it already. If you did, please say it again. How would you align if a nerve is out of position?
Okay,
Help me.
that's referred to as an adjustment.
Okay.
That's the particular procedure that a chiropractor provides. Chiropractor does a spinal adjustment, meaning that a bone's out of place, and through a specific technique, most oftentimes it's a hands-on technique, the chiropractor will properly align the spine.
Okay.
And in doing that, the normal nerve supply
Okay.
is restored.
Okay. Okay.
Then the body can heal itself.
Okay. All right. What attracted you to this particular field of medicine?
Well, actually, Dr. Lewis, I always wanted to be a doctor, and I was at Northridge Pre-Med and was about to consider applying to medical school, and I decided I would just look for some alternatives in case I didn't pursue the medical route. And found out about dentistry, podiatry, and when I found out about chiropractic, I knew that was what the Lord was leading me.
Really?
That was the direction the Lord was leading me.
Really?
I went to visit some chiropractors. I received chiropractic care myself. I went to a college and took a look at the college. And as I mentioned, I went to a couple of different chiropractors' offices. And I liked the relationship that chiropractors had with their patients. And I just felt that that was something that I wanted to do.
Early on,
Yes.
you made up your mind. You know, that's just like being a dentist or
Yeah,
something. You know, I
right.
wonder how people dentists and working people's mouths all day long. But I'm not called to be a dentist. That's
so
why I
that's
understand
it. It has to be your field, right?
Exactly.
Okay, now, I think we've already known. What was originally you wanted to become a medical doctor anyway?
When I was doing undergraduate, when I was in undergraduate college,
Okay.
that was my pursuit.
Now, are there any chiropractors in your family or physicians?
No, they're not. I'm the only one. And matter of fact, Pamela, when I first decided to be a chiropractor, I must say that there was some resistance. I've been in practice 20 years, and so I made this decision, 24, 25 years ago. And at that particular point in time, chiropractors weren't esteemed to the point that they are now.
Do I know that?
So it was somewhat of a decision that met with a little resistance. But I know that that was the direction that the Lord was leading me.
You sort of referenced, but if someone is considering becoming a chiropractor,
Yes.
what is required, or what would be the procedure, or what's the schooling, or what is involved with you, with one arriving to such a position of a doctor of chiropractic?
Okay. First thing they need to do is they would be in undergraduate school.
Okay.
Pretty much most of the chiropractic colleges now require a BA, and with that BA you'd have to have a certain number of units in certain subjects, for instance chemistry, anatomy, physiology, physics. You'd have to have most oftentimes a BA fulfilling certain requirements in certain courses, and you'd have to have a certain GPA.
Okay.
After you've completed that, then you would apply to chiropractic college.
Okay.
And if you're accepted to chiropractic college, then that's a separate area of study, which would be 4 years. And within the 4-year period of time, you would have time where you'd be in clinic. And after you've completed chiropractic college, then you have to go through some testing, national boards, and then you would have to take a examination for your particular state. After you've completed successfully the exam of that particular state, then you'd be licensed to practice in that particular
So in other
state.
words, if you wanted to go to another state, you would have to go through the licensing again?
Most oftentimes, unless the particular state that you're licensed will allow you to go to another state and practice.
I know we had some interesting stats about DCs, or doctors of chiropractic
Yes.
work. I know in it was stated that there's one chiropractic doctor for every 2,800 citizens. In Illinois, there's one for every 4,100 citizens. And so we see that there's really an open field. This is really an open
Yes, it
area.
is.
You know,
It is.
you're not overcrowded, in other words. Michigan, one doctor for every 5,200 patients, and so,
Right.
man, I mean, this is a world that you can really
Right.
that really opens up to an individual, huh?
It's a wonderful career.
Wow.
Wonderful
You have to
career.
really be a people's person too, huh?
It would be to your benefit, especially if because you're touching.
Right,
You're
exactly.
touching. You're feeling people, and the chiropractor, they can actually feel and sense what their patient is feeling, will be more effective in treating the patient.
I know. I just have to share, and because I so much appreciate you. Not necessarily being one that likes
used to that type of-
exactly
yeah, right.
that type of treatment. You were very relaxing. You know, you're very assuring. You were very professional, and he was very gentle. You know, he didn't force his way in because, again, you have to use the hands
Right.
too. And so I just really applaud you. I want to do that publicly. I want to applaud you because you're a very professional individual, and I appreciate that.
Thank you, Dr. Lewis.
I
Thank
really
you.
do.
So it didn't hurt. No pain.
You know what? It was very
How they tell
relaxing.
you so pain. That's what we used to hear.
Yeah.
It's going to be
How
so
they- how they
painful.
crack your bones
Right, they're
and
going to
crack-
crack you,
Yeah.
and it's going to be so much pain.
No, it wasn't painful for me.
That's incorrect. And the adjustments, particularly if a chiropractor is skilled in their technique, most oftentimes the adjustment will not be painful.
It was relaxing. It really
Yeah.
was.
See.
And then when you placed the hot pads on me, and I mean, it was just, I was in heaven almost. And in fact, I said, no, don't, because he was getting taken. I said, no, don't take it out. Is it over with already? No, not yet. Let it,
So you
let-
kind of felt pampered.
Oh.
Sound like it's kind of
Yeah.
almost
You-
feeling
you do.
pampered.
You do feel pampered.
For yourself, you
You
know?
do feel pampered. You really
Yeah.
do, because again, they go from the top of the head on down, all the
And
way
just
down.
the entire spine.
all the way down. I mean, easily,
Yeah.
gently, and you are pampered. And
Yeah.
so, no, don't let it be over with now. Don't send me back into the cold world now. You created a monster here. Okay. Let me ask you this.
Yes.
You have indicated that your chiropractic care comes from not only being a provider, but also comes from being a way of life that you practice. What do you mean by this?
Well, pretty much in that I believe in chiropractic. I believe in what I'm doing. I get adjusted. I make efforts to try to live a healthy life. I exercise. I try to have a good diet. And I just try to practice a healthy way of life. And in doing that, when you have patients that come in that have certain problems, you're in a better position to share with them from that particular point of view. And I also try to motivate the patients to try to make an actual adjustment in their lifestyle. And that is not solely just doing what's necessary to eliminate the pain that they may be in, but adjust their lifestyle, which would be one that would be more receptive to living a healthier lifestyle.
Healthier lifestyle.
So in doing that, I'll provide information about diet, information about exercising, just information about basically how to sleep and how to have the right ergonomic setup at your workplace.
Wow.
I know that you had a pillow in your office that was really to ensure a pleasant night's sleep and a proper night's sleep in.
Correct.
Because there are certain pillows that you should have and you shouldn't sleep on, right?
Well, the chiropractic pillow, well, actually it was a cervical pillow. Speaking of the vertebrae in the neck,
Okay.
that pillow is designed to support that curve, that normal curve that you have in the neck. Your regular pillow would not provide that type of support. So a chiropractic or a cervical pillow is designed to give you that specific support that you need in your neck.
And I remember you said that your recommendation would be not to sleep on two pillows.
Correct.
Okay.
Because what you want to try to accomplish when you're sleeping...
what you do?
How you do that? How you say that?
Took away your extra pillow, huh? Okay, we're sorry.
That's okay. You just want to try to position yourself when you're sleeping in a position where your spine is as straight as possible. And if you have two pillows, that would cause your neck to be flexed forward more than it should.
My God.
Goodness.
Pamela, throw away that extra
I know
pillow.
it's a learning thing, but oh goodness.
Yeah, let go
I'll
of that
have to let
pillow.
go of
Okay.
Now, Dr. Frank, you said that your practice is not just a business, but it's also a ministry?
Well, I think that may be a little bit strong, but I try to approach my patients from a standpoint of knowing that this is an individual that the Lord has created. I know within my practice I submit to prayer. I pray about every patient that comes in, and I feel that the Lord has basically sifted out individuals that I can't help and allowed the patients to come to me that I can help. So when someone is sitting across from me, I have a certain amount of confidence that the Lord has evaluated this situation and directed them. And when I think of it being as a ministry, I just take it seriously. It's a service. It's a work that I have committed to the Lord. My practice, I feel I've dedicated to Him. So from that standpoint, that's actually something that people have actually said to me, that my practice is more of a ministry more than something that I've termed it.
Well, I don't think that that's a strong statement.
Yeah,
I think that that's an honor
yes.
because you have just taken your God-given gifts and talents and interests and abilities and turned them over for God's glory.
Yes.
And like you say, you pray about your patients. And so with that being the case, I don't think that's an overstated statement or a strong statement. I think you should hold on to that statement.
right.
Okay, I'll hold on to it.
Hold on.
Thank you, Dr. Lewis.
You have several community involvements. Why don't you share some of them with us?
Okay, well, I'm first reminded of our organization I'm a member of here in Santa Monica. It's called the Santa Monica Gyms,
Okay.
and that's an
Gym.
organization that we raise funds for African American or Black high school seniors in Santa Monica or Malibu, and we usually have one fundraiser a year. And last year we gave out, oh goodness, quite a few scholarships
Okay.
to African American high school seniors. I'm also involved with the Santa Monica College General Advisory Board. I'm the president of that board. It's a board that acts as a liaison between the Santa Monica community and the Santa Monica college, Santa Monica College. Of course, my church.
Of course.
I should have mentioned that first.
40 last year. No. Just kidding.
Yes,
Just kidding.
I'm involved with my church, and I'm glad to be involved in West Angeles Church of God in Christ. I'm involved in the Executive Healthcare Committee. I'm involved in the discipleship program under Elder Albert Williams. What else am I involved in? That's all that comes to mind right now.
Okay, all
Yes.
right then. Now you've been awarded the Business Professional of the Year and the Los Angeles Watts Times LA's Best Black Doctor Awards. Congratulations.
Thank you.
All right.
Thank you,
And we
Dr. Lewis.
certainly can. We're sitting
right.
with a celebrity.
I
huh?
tell you.
All right. We are honored to be in your presence. What are your future professional plans? Do you have any?
Basically, just to continue to propel my practice forward, to be able to expose myself to as many people as possible and provide good health care for as many people as possible. I do a lot of marketing in the African American community, not just solely, but that's one of the areas which I feel drawn to because there's been so many misnomers in the African American community regarding chiropractic. So I'd like to just educate more people about the benefit of chiropractic and the benefit of good health care.
Yes.
Well, we only have a few more, couple of more minutes or so. Summarize for us, please. What would be your advice in someone going and making their trip and visit to the chiropractor an enjoyable one or a beneficial one? Maybe that should be the question.
Well, hopefully that it'll be a beneficial experience because they'll be going to a good chiropractor. Most
Like yourself, okay.
Yes.
Okay.
I would make sure that they're going to a doctor, a chiropractor that's going to take the time to do a thorough history, evaluation, and an examination. Going into the chiropractor's office and just initially getting an adjustment would not be something that I would suggest. I would just make sure that they're going to a chiropractor that hopefully they've been referred to, and that the chiropractor's taking their time. They're not rushing them in. They're not rushing them out. And just get a sense as to whether the doctor cares about you. That's so important.
So important.
Now, a doctor caring about you is not a substitution for having excellence in their clinical skills. But it's also something that is really helpful when you know that the doctor cares about you.
Okay. Pamela, you have a final word?
Well, you know, we know that God has designed our bodies. And so actually our bodies are the temple of the Lord. And I guess we have to keep them in tip-top shape, right?
Yes, we do.
Because this is the only body we're going to have.
Right.
But you know what I want our viewing audience to know, that today is Dr. Frank's birthday.
Oh,
so we want to say
yes.
Happy birthday, and what a blessing to come and be with us.
Thank you.
So, because of that,
We have just a little special love gift for you.
Thank you, Dr. Lewis. Thank you, Pamela.
now since you
Thank
are
you
a
so
doctor,
very
maybe
much.
you can't eat those cookies, some of those things you might not
Yes.
be able to eat on your diet.
But in any
Thank you so very much.
we want you to know
Thank you
that we
very
have been
much.
so honored to have you on this your very special day. You spent your
Yes.
birthday with us,
Well,
you and your
it's an
skeleton
honor
friend.
and a
But in any event, thank you, Doctor, and the Lord bless you.
Thank you.
If you would like to
Thank you.
get in contact with Dr. Frank and find out more about his practice and where he's located, again, you'll want to get your pen and your paper and copy down our email address, our fax, our phone number, whatever the case may be, our P.O. box. Contact us. Let us know how beneficial this show has been for you. And again, we can place you in contact with Dr. Frank. Again, take care of yourself. We love you. Remember, Jesus is the answer for any problems that you may have. And of course, we encourage you to seek out a Bible-believing church and find the Word of God to heal all hurts and harms. God bless you. We love you. Until next time, take care of yourself. Wow. That was really
Come on, put those hands together for Jesus. Come